Okay, thank you for coming. Today I'm going to talk about diabetes type 2. I'm sorry for the technical problem that happened. And as you all may know, there are three different major types of diabetes: diabetes type 1, diabetes type 2, and gestational diabetes. One of the most prevalent and common type of diabetes is diabetes type 2. And the importance of diabetes type 2 is that because it's a lifelong disease and chronic disease, so we have to pay attention to it and try to control it, and if it's possible, try to prevent or delay the diabetes type 2. So today I'm going to talk about how we can prevent that and what is the risk factor and how we can control that. As you can see here, in 2009, 2.4 million Canadians had diabetes type 2, and this number will be increased to 3.7 in 2019. So it will be a huge, huge increase. So it's really important to take care of diabetes because it consequently may cause stroke or heart disease and nerve damage or amputation. And as you can see here, over 40% of people with diabetes don't know that they have it. So it's really important to find out. And what mostly worries the expert is that 4 million Canadians have prediabetes. Prediabetes is the term that's used for the people who have a blood pressure more than normal, but not high enough to be said as diabetes. So, and most of these people don't know that they have prediabetes. The importance of prediabetes is that between a third and a half of people with diabetes will develop diabetes in the future. So it's really important to take care of it. And also the risk, also prediabetes has a risk factor of heart disease in the future. So the only way that we can find out if someone has diabetes is to get the blood sugar tested. And it should be the fasting blood sugar. The person that doing the blood test should be 12-hour fast. And as you can see, if the blood sugar is 7 millimole per liter or higher, it would be diabetes. If it's between 6.1 to 6.9, it will be prediabetes, and below 6.5, it will be normal. Here I just wanted to talk about the risk factor of diabetes. So the people who have this risk factor is a higher chance of getting diabetes or prediabetes in the future. One of them is age 50 or over, people who are overweight, or those who have a parent or sister or brother who has diabetes, and people with Aboriginal, Hispanic, Asian, South Asian, or African, and people with high blood pressure, 140/90, and also low HDL cholesterol. As you may all know, HDL cholesterol is a good cholesterol. So when the level of HDL cholesterol is low, so that would be also a risk factor. And also, women who had diabetes during pregnancy or giving birth to a child more than 9 pounds would be also a risk factor. And
me.
Yeah. Really?
Ryan was 11, 12.
Oh. And also people who have a sedentary lifestyle or are active fewer than 3 times a week. But the good news that I wanted to share with you is that we can prevent or delay not only the prediabetes but also diabetes type 2. The first step that we have to take is lifestyle changes. It's really important. Even people who diagnosed with diabetes type 2, the first step of treatment that the doctor will recommend is the lifestyle changes. And then if it doesn't work, the doctor will recommend drug therapy. So it's really important to lower the calorie intake in our diet and try to decrease the amount of fat and also saturated fat, which is really harmful. And having the high fiber in our diet for example, between 25 to 50 grams per day. Physical activity is really important, having a brisk walk 30 minutes, at least 30 minutes a day. And as you can see, if someone try to do that, it will increase the chance of diabetes by 5%. And also, reduction in body weight can also be helpful. As you can see, diet and exercise can lower the risk of diabetes by 58%. Here, as you can see, 4 out of 5 Canadians with diabetes are overweight. And what is exactly happens when someone gets diabetes is that the body cell become resistant to the insulin hormone. So the pancreas try to keep up with it and try to secrete more insulin. But after a while, it tires out and the blood sugar gradually increase. So when the blood sugar is increased, when the blood sugar increase, it will increase the chance of blood pressure, high triglyceride, and also inflammation of the blood vessel. Again, I emphasize on the importance of losing weight and exercise here. That will help to prevent diabetes type 2. And one way to prevent that is to build the diet around the vegetables and try to eat more fish and low-fat dairy product, and also having a regular meat, and also be aware of portion. I will explain about the portion later, and also try to have physical activity. In this slide, I'm trying to show you the effect of smoking, because smoking is also a risk factor for diabetes. So it's very important to quit smoking. If someone smoke, it will be increase the chance of diabetes. And as you can see here, walking at least half an hour can lower the risk. And using polyunsaturated oil is better than saturated fat. Like, try to use at least vegetable oils instead of meat, cheese, and try to use less trans fat acid, like muffin donuts that can lower the risk.
Looking at the table.
I know. Like, what are those?
No muffins, no donuts.
Yeah, I don't eat any. Yeah, I don't have those anymore. Me is just
Your
cheese.
weakness is just cheese.
Not even oil, not even nuts. A muffin donut and
soda.
What? Zero. But exercise we do. Boxes, lifting, everything.
Sharper's chalk.
That is aerobics. Okay, so
And also try to have a diet high in fiber, and also at least 25 to 50 grams of fiber can also help. In this slide, I'm going to try to explain about the glycemic index. Glycemic index is a rating system and will rank different food according to how much carbohydrate it will produce in the blood compared to the standard. Standard is a piece of white bread, and it's highly recommended to choose a product or take food which is lower in glycemic index and also high in fiber. For example, try to take a brown product instead of white one. For example, brown rice or brown bread instead of white bread. As you can see, white bread has a high glycemic index, but the 100% whole wheat or oatmeal has a low glycemic index. Or I gave some example here: sweet potato instead of regular potato, or pumpernickel instead of white bread, or oatmeal instead of
better.
Yeah.
Sweet potato is gross.
Yeah. Here I wanted to explain about the effect of alcohol. Studies shows that women who drink as little as half a drink.
Yes, come on, listen. Does anybody half drink is better than none?
Yeah, half a drink is better than none.
Yes, I don't see beer anywhere. I'm good.
Yeah.
That's it. I'm drinking every day.
Yeah.
Every night. We're going to Moxie's every night after work.
So is that beer or should be?
No, beer is bad.
Beer,
Yeah,
yeah.
beer is
should
bad.
Beer is bad for your
Either
belly.
wine.
It just
or
gives you like a pregnant
wine.
belly all the
a shot of
time.
whiskey, shot of vodka, or a shot of vodka.
Why?
I can do that. Okay.
That's good to know.
I'm fine then.
The beer is bad. Beer has high calorie.
So,
I'm switching that.
so as you can see, half a drink can have those who drank half a drink have a lower risk than
They can
non-drinkers.
have half a glass
However,
of wine from
Yeah.
now on.
But they usually say wine is good with
heavy
dinner.
drink. Wine is good. Yeah.
Yeah, one glass
Wine
is good.
One glass is good.
yeah.
It's even good. Yeah, your mom take it every day.
I just
Yeah,
have it
I
when we have a
never
party.
drink every day.
I never drink wine at home.
Until our bottle's done. It's a large bottle.
Only at the party. At the
Red is
party.
bothering my stomach like a hell.
Red?
Yeah, white is better.
I like ice wine.
Isn't that sweet?
It's once in a while. It's Christmas time.
Okay, sorry. Continue.
Sorry.
No
Yeah.
problem. However, heavy drinking may increase the diabetes risk. Effect of coffee on diabetes. Women or men who drank 4 to 5 cups of regular coffee have a 30% lower risk than those. Yeah.
Really?
4 to 5 cups. But it's
4
not
to
good
5
for your heart,
cups?
though.
Yeah.
There's no win because it's not good for your heart.
Yeah, but you have
Don't
to.
add cream or sugar.
Yeah, don't add cream or sugar. You can use
How much sweetener?
Cinnamon. Yeah,
Cinnamon.
sweeteners are not good. They may cause
Cinnamon.
cancer.
Cinnamon is
Yeah, cinnamon lowers the blood sugar.
Yeah.
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 I put it in my
My
coffee.
coffee.
That's good. Good
Every
for
morning.
you.
Just
Good
laugh
for you.
with cinnamon.
Yeah, that's
I don't know
good.
why.
Good for
I've
you.
lessened my sugar. And
Unless
I
I
use
buy it
brown
at
sugar
Tim
now.
Hortons, then I
Yeah,
have a
brown
double
sugar is
double.
better than white.
For some reason, I don't know why.
It is.
Sorry.
And as you can see, processed meat is not really good for diabetes.
Oh, no.
Mr. Mar?
Yeah.
Bacon nine.
It will increase the chance of diabetes by 90% in people who take at least 5 times a week.
Oh, Lord.
Eat hot dog
And-
5 times a week.
What about my pizza? It has
And
bacon,
the way-
pepperoni, and sausage on it. I have it at least 2 or 3 times a week.
Don't do that though. Vegetarian pizza. You have to flip.
Switch it up, switch it up.
And also the way that you cook food is really important because cooking food in high temperature can cause the formation of some end product that will be affect how the insulin works in your body. So it's better to try to cook at low temperature or at least cook in liquid to avoid these endpoint products. And sugar drinks is really bad and it increases the chance of diabetes. Those who drink one sugary drink it will increase the chance of diabetes by 15%. And so it's really important to, when you're going for shopping, pay attention to the labels and pay attention to the portions. And here, I just wanted to explain that taking fresh food is better than drinking fruit juice, because in nature, sugar comes with a fiber in fruits, so the fiber will delay the absorption of sugar in your body and will also increase the sense of satiety, and so it's better to take the fruit instead of fruit juice. Fruits. And here, as I told you before, the only way to find out if someone has diabetes or pre-diabetes is to get the blood sugar tested, and everyone 40 years or over are recommended to do the blood test at least every 3 years. So if someone diagnosed with pre-diabetes, the 3 steps that we can recommend is that to cut a food portion by 1/3, and to have a physical activity at least 30 minutes a day, and lose weight about 5 to 10 pounds if they are overweight. These are the important tips that I took from the CDA, the Canadian Diabetes Association, and I just wanted to share them with you. Just a quick review. So it's important to take 3 meals per day at the regular times. Do not stay. Yeah, don't stay more than 6 hours. And if you feel hungry, you can take a healthy snack in between, and also try to limit the sugar intake as much as you can, and try to decrease the amount of sugar and also dessert, candies and honey, and also limit the amount of high fat food, and try to avoid chips? And pastries. Yeah.
Potato, madam, potato.
Oh man.
And also eat more food which is high in fiber, like as you can see, lentil and peas, brown rice and vegetables, having physical activity. In this slide, I'm trying to show you a plate model. It's considered as a nutrition guide, and if you wanted to follow a healthy eating in each meal, it will give you the idea. And